was really only one high-profile presentation about standard chemotherapy that I can think of, and that was in the squamous population, a Japanese study by Shikula and colleagues that looked at nedaplatin, a new platinum agent, compared with cisplatin, each combined with Taxotere, docetaxel, and it showed a survival benefit. Jean-Charles, what did you think of the trial? What were some of the highlights that you could see, and is this going to go anywhere?
Well, I think our Japanese colleagues have to be congratulated because they did, an extensive amount of effort to randomize and perform this trial, and displacing the king, because cisplatin has remained the king. I know you in the US like carboplatin a lot, but the rest of the world believes cisplatin is the king. So it's to be commended. I was pretty enthusiastic with the data. I think one of the key problems to translate that data with the survival benefit to the rest of the population is obviously the dose of docetaxel they use, which has nothing to do with the dose we use. It's 60 milligrams when we use 75 milligrams. And therefore, one starts thinking, well, is this about how the Asian population metabolizes the drugs, correct? I mean, it's encouraging, but in an era where you have immune checkpoints, who's going to do in a Caucasian population a trial with a new platinum compound
versus
it's not going to be easy, correct? But I think it's encouraging, and we should keep that compound in mind. Maybe my advice to the company who has that compound is, let's see if this leads to immunogenic cell death, and in that case, they could partner with an immune checkpoint.
Well, just to put it directly, if you had the drug commercially available, would you consider that appropriate to substitute wholesale for cisplatin, or would you say it needs to be validated outside of a Japanese population and with a partner drug and dose that is conventionally used in Caucasian or non-Asian populations?
That will be my conclusion. I mean, I will need the latter.
What did you think?
Yeah, no, I completely agree. And I think I would emphasize Jean-Charles' point that I think we're not going to do trials in a non-Asian population because we are focused on immunotherapy, not just in combination with chemotherapy, but as a potential replacement for first-line chemotherapy. So I think the entire field may be moving in a little bit of a different direction.